And welcome to Long COVID Foundation podcast. This is the channel where we share educational information on long COVID to help you understand your symptoms better. So if you want to learn more, please watch this talk from start to finish because it will help you to learn more. And just very quickly, if you're new to the channel, make sure you hit subscribe button because I can help you to get answers relevant to your symptoms. And don't forget to give a video a like because this tells me that these videos are helpful and at the same time it motivates me to create more content for you. Drop in the comments what are the most worrying symptoms you have experienced with your doctors, and we together will try find solutions. Thank you very much, and let's get straight into our interview.
Because of the pandemic, because of the capacity issues in hospital, are not getting the most apt treatment because of the sheer volume of patients. I'm sure my colleagues are not bad people. I'm sure they're trying their best. I'm sure they're working from the medicine that they learned. If we are to progress in medicine and in the treatment of long COVID, which to me looks like we need to detect microclots, treat them, unless we do that, then patients will come to harm. And we need to stop this psychologizing of people who have significant symptoms. There are children I know of.
So exactly, this is what I wanted to ask, because there are thousands of children who developed long COVID, and we definitely need to bring that more widely and raise concerns why children are not taken seriously in this illness in comparison to adults. Yes, in adults we have long COVID clinics, at least some kind of support to speak to somebody who at least knows what long COVID might look like. But for children, I think we don't have this support. Even that support is missing from the system. And overall, talking about dismissal of long COVID as a disease in the UK, I would definitely think that there is not enough resources put into development of protocols that are being communicated to general practitioners, to specialists. And long COVID is not taken seriously because of that. There is no investment from government to analyze symptoms properly. And the investment is put to research institutes that try to reinvent the wheel. So very academic research rather than something that practically would help these people. I don't think governments are funding the right institutions and allocate resources to the right people, organizations, labs who definitely have huge demand for these tests, for these clinics to treat people with coagulation issues. So in terms of testing that was undertaken in Germany, how significant work it is to have this test in the UK, because TEG as a test is widely known. There is nothing new about using TEG on blood of those who suffer with cardiac issues, for example. So what are the main obstacles you think in the UK for using these machines on long COVID people?
So I think there are a number. I know people who've tried to get their blood analysed at a lab and have been told, no, we need special tissue authority authorization for this. We can only handle samples that have been already prepared. Unless they're prepared in a certain lab, then we can't handle them. Other people saying, yes, of course you can use our labs if you pay us X thousand per week and use them out of hours, and you have your own staff. Mm-hmm. It's been a long time since I've used a microscope, realistically, so I don't want to pretend that I'll easily find them. I think with using Ricia's protocol, hopefully, I and others will be able to find them using a student microscope, but we shouldn't have to. This is a health emergency that needs to be addressed. And if we're ignoring it now by not giving adequate funding to labs, not telling GPs, if somebody comes to you with post-viral symptoms that persist, or you have concerns, please do these other tests, von Willebrand's factor, anti-2 antiplasmin, fibrinogen, LDH. Mine were all raised, but they're not common ones which are done in GP land. Unless we come up with specific protocols and we have government funding, we're going to struggle. I think even if we were to bring over certain machinery from Germany or have it approved, it will take a long time due to funds and the way that the NHS works. I think the NHS is great for what it is. In the pandemic, it's really struggled. I think it's got to be safe and free the point of access. To juggle all those together while there might not be funding, thinking, do we need to go to a private collaborator to do this? Is this ethical? So many considerations. If I can just go back slightly to what you said about children, though, I know several parents who have very sick children who schools have, for example, said, well, we still need to get the child in for an education. If that child is bedbound, has severe cognitive impairment afterwards, there's no capacity in that child's mind to be able to process anything. And that then becomes a safeguarding issue. I'm really passionate about safeguarding. And it's hard in adults and children to sometimes know what's right when there's multiple voices talking at multiple agencies. I've seen some difficult interactions, which people have shared with me, of, for example, schools and services saying, well, this needs more speech and language therapy, this needs more physiotherapy before this person can get back to normal, while the person cannot eat. The child's being fed by the mother or the father or the caregiver, even in adults too. And it's difficult. I don't have all the answers, but I think unless we focus money on research, on providing services, lab services to at least detect microclots, to then make a plan for GPs to go by a certain protocol, which might be off license at present because of the way that the NHS runs. If it's proven with the research papers, I wonder if patients with post-acute COVID syndrome, ME, CFS, if they have microclots, if they would also benefit from that. And I know we've discussed at length about that, and we're not going to touch on that today, but I think that's a topic for the future, which is really interesting, which probably needs to be brought to the UK and around the world. Do you agree?
Absolutely. I think it's important to bring the right testing, and these diseases are for 10 years there, and people with the severe disease cannot operate, losing their jobs and losing their appropriate life and still being dismissed. It's a huge problem, and I don't want to be very pessimistic about the long COVID, because as a charity we want to bring expertise together, and I'm really happy to find people like Dr. Jaeger, like yourself, like Professor Pretorius and other scientists that tirelessly working on identifying solutions and diagnosing long COVID in an appropriate way, trying to identify biomarkers so that our policymakers are able to produce necessary protocols to be communicated to first-line medical practitioners that would listen to patients, not just dismiss them and believe. So I think we will summarize this talk today that we need funds, and we are on the right path of identifying what long COVID is, and we just need support of public and people. Please share your comments below the video, whether you have experienced similar stories that Marek has told today, and if you struggled with your testing in the UK or anywhere else in the world, and what is the situation in your country, please put in comments so we know what is the problem, how global this problem is, and I'm sure we're going to find a solution at some point, and we all as a team work really hard to help everyone recover.
Thank you, Valentina. So before you summarize, if it's all right just to add something, my mum developed polio in a concentration camp in Poland. My mum's no longer with us, but she had quite bad post-polio syndrome. When she was younger, it mainly affected her limb, but when she got older, it affected her breathing, her heart, her brain, muscle wasting, polio, post-viral syndromes. Okay, I think that unless we tackle COVID, post-COVID syndrome or sequelae now, then we risk a disabled generation. And especially if it's children, their whole life is going to be affected. And we're talking about workforce, people who are caregivers, families, they're going to be all affected. I think we need to target in the nicest possible way things so we can identify the clots, figure out what's going on, so that people, and there are thousands of people who are like my mum, who I know from the British Polio Fellowship, of which I'm an expert panel member. There are lots of people out there who've been gaslit through their lives because they were told a viral condition happened, you don't have it anymore. Because people don't understand, it doesn't mean that the condition doesn't exist. I think it means, your books are from 20 years ago, let's close them, let's have a look at the new research. If we don't have the answers to existing symptoms or problems, we need to dig deep, we need to act now. And I just hope that people listen to this, medical colleagues especially, so we can just collaborate together. It's not us versus them, it's all of us working together. It's not doctors versus patients, it's just, let's get through this together as best we can for everybody's benefit.
Thank you, Marek, for great remarks at the end of the talk. And please, everyone, stay in touch and share your comments and share your views on what you think, how research should be directed, because you are patients and you are the people who know this disease at most. Thank you to everyone and goodbye.
Thank you.